My name is Alexander Parker. I come from Elysium Medical in Oslo, Norway. We are here in Barcelona and visiting Dr Hilu. He's the best doctor in the world of analyzing the blood. He's also one of 2 doctors in the world that does an absolutely fantastic stem cell surgery. So, Dr Hilu, thank you for seeing us.
It's my pleasure.
Yes,
Alexander.
Thank you. So, what is this behind me here? Can you explain?
Well, this was made by one of my friends, a French doctor, in fact. He took pictures of the blood before and after a specific therapy for oxygenation. The very red bits is dried blood. It's a blood that is taken in a different way in order to study under the microscope how it dries, how it coagulates. So it's a coagulation test. The rest is the lifeblood, the fresh blood, the normal blood cells that you study under the microscope that any hematologist or lab expert would be looking into. The only difference is that we look at different morphologies, behavior. We don't count things. It's not a type of analysis to know how many red blood cells or how many white blood cells. It's a type of analysis to see what's in there and what is it doing and is it right. And if it isn't, we decide what to do to make it look right, which would be the picture on the right.
So what is that morphology?
The shapes. And even the size is important. The size of a red blood cell. If it's very small, if it's very big, if it is elliptical in shape, if it looks like a teardrop, if it's square, white cells likewise, and the content of the serum also. The serum, the plasma should be clean. If it contains certain particles that shouldn't be there, this will also be giving us information about what organs are doing what.
I see. So, you're the best doctor in the world of doing this.
That's what you say, and some others as well.
Yeah.
Thank you.
Because it's all about reading the morphologies. So, it all depends how many morphologies you can look, the better you will be.
Yeah, that's true. The more information you get from the analysis, the more you can help the patient. It is true that most of cellular analysis experts can read less than 60 morphologies or 60, get 60 pieces of information per sample. After 20 years of investigation on our centers, we can read more than 800 morphologies. There's a lot of work behind this. There's a lot of investigation, help from other labs to double check that what we are seeing corresponds to this, that, or the other. In this regard, yes, we do read more morphologies than anybody else. If this means that we are the best, then you are right. If it means something else, well, it will be that something else.
Okay, fantastic. What types of illnesses can we treat with this type of method?
Your question is very good, because if you asked me what type of illnesses can we see, I would have said none. Because we don't see the illness. We see the cause of the illness. We don't see labels here. Oh, look, here's fibromyalgia. Oh, heart problem. It doesn't show like this. But the factors, the risk factors that cause any illness will show. Because illnesses do not happen just like that. Before an illness occurs, things go wrong. The things that go wrong, we know how to read them. Once we find what things are wrong, we fix them. Once they are fixed, the illness disappears. Or the tendency towards that illness, and that's my favorite part, which is preventive medicine, then we can avoid a cancer to happen or a heart attack to occur or what have you.
Amazing. If let's say if I have cancer, what kind of success rate will I have if I have, let's say, pancreas cancer? And what type of success rate do I have? in general with this type of disease?
Well, this is something else. This is not 100% related to the blood analysis, because in the blood analysis we would find out the cause of your cancer, whichever cancer it is, even if it's pancreatic cancer. We'll go to the base of the problem. But it all depends how advanced the disease is. If it's too advanced, we cannot do much in favor of curing the patient. We can help the patient get better. But after many years of experience and work with other doctors and other colleagues that they are the best in what they do, we have got to know the best in almost every type of treatment. For instance, regarding pancreatic cancer, there is a radiosurgery center in the United States, in New York, that's specialized in treating pancreatic cancer by means of a special type of radiosurgery. And they have a very high success rate. Normally, success rate in pancreatic cancer is 2% with the traditional methods in advanced pancreatic cancer. And with this stereotactic extracranial radiosurgery they do in New York, they are exceeding 95% of success rate. But this is not the blood. This is the technology that is used to treat the patient. And even if we go back to the blood, there are two readings to it. A good doctor probably is very good at analyzing. So I know exactly the cause of your disease. It's this. Be it with a blood reading or with any other method. Now, what do we do with this? What do we do for the patient? Are we sure that what we are going to do is the best for the patient? Now, this is not blood. This is experience, this is investigation, study, and I don't think I'm the best in that. I'm good, but I'm not the best in that because I've spent most of my time investigating the reading. We have very good results in treating patients. We are exceeding 80% success rate in general. Wow. But it's not me. It's my medical team, medical devices, and my supervision. Yeah. So I'm not that brilliant in the treatment, say. In directing the doctors and the medical team, yes. In looking at the causes, yes.
And other illnesses like arthrosis and MS and Parkinson, Alzheimer, what kind of can we help these types of diseases as well?
Yes, in fact it's the same story, Alexander. As I've just already mentioned, the reading of the blood is not going to tell us, here's the Alzheimer, here's the Parkinson. It's not a reading for the disease. It's the reading to see the cause of the disease. So we are very, very lucky to be able to tell in each case what's behind their disease, which makes life much easier. So it doesn't matter what the disease is, we can always help them, without exception. Even if it's a disease of unknown origin or it's a disease that has no name, it doesn't matter. The procedure will be identical. So after they make the appointment, wherever they do so, we take 1 drop of blood from their finger, put that under a microscope, a specially adapted microscope. It's an optic microscope, not electronic. And we magnify the sample up to 65,000 times, and we start looking for defects. And I would be reporting to the patient the defects, the irregularities, the imbalances, whichever ones they are. I would exactly explain to them what is wrong on a cellular level. Once this is finished, it takes about 20 minutes to do the full study, both the coagulation test and the live blood test. We do it also with other countries because the sample holds for 10 days in perfect condition. So it can be studied later, a few days later, without any problem. So once we know what's wrong, between 0 and 842 different possible irregularities, we put that on a written report so that we don't forget what we saw. And I start to look at methods to correct everything that's wrong. Because many times, and we are still very much behind when it comes to knowledge of the causes of diseases. Many times the cause of a disease is a minor issue that we saw in the blood, but we didn't know it was related to the disease. So the philosophy we use at our clinic is whether we understand if this is related or not to the disease, we treat everything that's wrong. Because everything that's wrong is going to be harming the patient, whether related to the disease or not. So we try to fix it all. That's why our success rate, as I mentioned, exceeds 80%, because we're fixing almost everything that's wrong in them. So of course they're going to get better and be cured, even if we don't understand how this is happening. So we try to correct everything. We use different methods to correct. Easiest, diet adjustment. We are what we eat, so the more precise the eating habits, the more adequate the eating habits and what we put into our body, the better the body would react. That's number one. Number two, if it's not enough with diet, we help the patient out with additional supplements because his body is unable to take everything from food. We help the patient. Number three, if number one and number two are not enough because the patient is weaker than that or the disease has gone a little bit further, we use specific medical devices. We use many of them. So there's a long list of devices that help the body recover. And if 1, 2, and 3 is not enough, then we have a big consultation with our medical team to see what else we can do. If we still don't know what to do and things are complicated, then we contact big brains like this oncologist in New York or other centers that are specialized in other diseases to give us a hand or to help the patient directly with their problem.
With all these techniques, are you able to reverse these diseases like MS or Parkinson, or is this possible?
The answer is yes, it is possible. What varies is what could happen from one patient to another, because every single patient is different. If the deterioration of the organ that's responsible for the disease is beyond 50%, i.e. beyond recovery, then we cannot cure the disease. It doesn't matter what the name of the disease is. If it's in earlier stages, yes, we can help the patient recover health. But even in advanced stages, we can always help the patient to get better. Probably not to be cured, but yes, to have a better quality of life, to shake less, to have a little bit better of memory, to have longer hours pain-free, and depending what we are talking about.
What other types of specialties do you have? You have stem cells, correct?
Yeah, I only do two things. The one that we've just mentioned was cellular analysis, the study of the blood under microscope, and the treatment that would be set up in order to correct whatever is wrong that we have seen under the microscope. And the only other thing I do is stem cell surgery. I only do autologous stem cell surgery. And I only do autologous stem cell surgery that I carry out in the operating theater without sending the bone marrow away. We set up our own lab inside the operating room, inside the operating theater, and we do everything in a closed circuit. Nothing leaves the room. This way, it's not a transplant. It doesn't need paperwork. It's like taking blood from one side, putting it in another, or taking a piece of skin from one side, putting it in another. You don't have to ask for a special permission for that. All doctors can do that.
Yes.
In other words, you just need to know how to do it. Of course, in order to be able to carry out such a procedure, we need to set up specific equipment and work with qualified nurses and fellow doctors that know what they have to do.
What type of illnesses can you cure with stem cell surgeries, with this type of stem cell surgery?
None. We don't cure any illnesses at all. What we do with this procedure is achieve an improvement in the quality of everything in the body. It's a systemic improvement because the procedure consists of selecting the stem cells and teaching them how to differentiate. We put them back into the body by means of a drip, and the cells will go wherever they have to go and will repair whatever they have to repair. So after this surgery, the patient will get a younger liver, a younger heart, younger kidneys, younger everything, would end up having a better immune system, and will be able to fight off his own diseases, provided he does what he has to do. I mean, if we do this and the patient still takes drugs and still taking excess of alcohol and so on, he will ruin again everything that you would have done, but it'll take him longer to ruin it. So it's not designed for a specific disease. It's designed to internally rejuvenate the person. That's when it comes to the drip application. There's a second way to use the stem cells, and we do that, and it's legal as well, because there are many things that could be done, but they are not legal. And these are the ones probably you are asking about. But we can't do them, and we don't do them. Like putting the stem cells in a pancreas to get rid of diabetes. Technically possible, legally impossible. So we can't talk about this. We don't do it. But there are things that are legal. For instance, you can put stem cells in a knee, and if there's osteoarthritis, you can regenerate a little bit of cartilage, a little bit of bone, and then the knee gets better. So you can help fix osteoarthritis.
Wow.
So that is one application, for instance, local application. And also it's legal to mix stem cells with fat when you do fat transfer in plastic surgery. And this I have done also in the past. It's not my favorite because it doesn't fix health. It's only for beauty, but it's interesting. So if it's somebody who wants to have bigger breasts or larger cheeks or lips, and they do not want to put silicone, we can make a fat transfer. Take fat from a specific place in the body where there's an excess of it, put it where they want it, and to avoid this fat to be reabsorbed again and dry again, so 2-3 months later the patient would look exactly the same as they used to, we enrich the fat with stem cells, again, autologous stem cells. So the fat continues to live as if they always had it there. It's an interesting technique, but these are the only areas really. The fat treatment for plastic surgery, the treatments that are done for traumatology, for knees, for ankles, elbows, and so on, and the overall regeneration, which is the drip for rejuvenation.
So how many years can you rejuvenate? Can you, 10 years, 15, 20?
Our record so far has been 20.
20 years.
And the least has been 8. So it's probably an average of 15, or maybe 12, I'm not sure.
It's amazing.
Anything between 8 and 20.
Thank you, Dr. Hilu.
My pleasure.
It's been a pleasure. It's an honor.
Thank you.
Thank you for your time. It's a pleasure to do. We are looking for the bright future.
All right. See you in a few months in Oslo.
In Oslo, Norway. Yes.
Thank you, Alexander.
Thank you.
Have a good day.
You too.